This is Chris from Campersoft Tissue Therapy. It's really important to have your desk ergonomically set up to avoid long-term pain, especially myofascial pain in the neck and thoracic spine. A common thing that we treat, especially being Canberra with a lot of public servants in a sitting position, is a lot of thoracic spine tightness, burning sort of feeling through here. Tissue that burns is nerve or myofascial, so the fascia is like the white tissue underneath the skin around all the muscles. Usually it's the myofascia, not nerve. So there's this burning feeling that comes through here, maybe through here as well. So with Mick here, no matter how good he is at the start of the day, if his desk isn't set up well, he might start with good posture, but within a couple of hours he's got bad posture just because the muscles get tired. So in this case, if he really starts to slouch forward here, so he'll get this bend through here. This makes all the facet joints open, pushes the rib heads back, which can be a major source of pain as well. If he's doing a lot of mousing with his right hand and it's not set up right, he'll actually put this drag on this tissue through here. So with this rotation, this bend through here, as he goes over more in the day and he screens up here, he'll want to do this as well. So his eyes want to be level. So this just compresses all through here, creates psychogenic headaches, all sorts of things. So when we treat, we open up the muscles through here because they're short. We lengthen through here because that's all short as well. We shorten through here, we knock out tone. Big time we need to open up the chest, open the diaphragm because the breathing is suppressed because of that too. So that's pretty much basic knowledge in soft tissue therapy. If you come around this way, a lot of people, the side they mouse on, particularly if it's not set up properly, the rhomboid here, so this muscle that comes through this area here, becomes too long. So muscles can give you pain because they're too short or they're too long. Usually it's the ones that are too long that causes problems. And in this area here, people tend to like to put a lot of heat on here because it feels better. It feels better for a little while, but it can make it worse because it makes the muscle longer. So this tissue here, as he's reaching forward, actually lengthens through here. Doing this for a long time, actually the spinous processes, the sort of spines of his vertebra here, they actually get dragged across. So there's a rotation that's created in the vertebra, which then makes his head need to turn that way as well. Okay, so that can be something that doesn't leave when he stands back up. So this tissue is too long here, and it tends to make the torso also rotate that way. And of course his head won't want to be there either if the screen's in front of him, so it'll turn back there. So the SCM, this big muscle here, is too short on this side because it's helping to turn this way. This one is too long on this side. The scalenes get really short on this side here, the pecs. So to treat this, we're looking at knocking out tone through here so everything can move better, we can actually get more extension again. We need to lengthen through the pecs big time, lengthen through the subscapularis through here, through the lats. When the arms come forward, it's the pec and the lats that hold it forward. The bicep gets very tight too because the humeral head starts to sit forward in the socket and the bicep holds it forward in the socket. So we release that as well. And we need the defecus and strength work going into here as well to help bring that back without him having to think about bringing it back.